Welcome to RUV Psychological Care, and this is our third episode. My name is Vincent Kioko. I am a medical psychologist. So, in our last episode on autism, we said that we are going to talk about another disorder, and today I would wish to share about bipolar, actually called bipolar. So, a bipolar disorder is just a mood disorder and also a mental disorder that is characterized by a depressive episode and also by a manic episode. So there are several forms of bipolar, and the first one is what we call bipolar 1 disorder. Second one is bipolar 2 disorder, and then the third one is cyclothymic disorder. So with bipolar 1 disorder, it basically has a major manic episode and also a major depressive episode. The bipolar 2 has an hypomanic episode and also major depressive episode. With the cyclothymic, it occurs majorly in kids and also adolescents, and it has several hypomanic episodes and also several depressive episodes. So, I know you're wondering when I talk about mania and also depression, but then a manic episode is a combination of several symptoms, and I'm going to expand on them. So the first one, we say that someone who has mania will tend to have a jumpy behavior or a stupid behavior. A jumpy behavior is a situation whereby they'll just wake out of nowhere and run or do something funny. And then they'll also tend to be highly euphoric. They tend to be excessively happy, and they also tend to by the way, they tend to lack sleep, they have insomnia, and they also tend to be agitated or irritated very fast. So there are also other symptoms of racing thoughts and also poor decision making and poor judgment. Okay, now with the depression is actually a broad topic, but there are a compound of symptoms which make someone to be depressed, and they are several. Actually, it's not one symptom that can make someone to be depressed. So someone who is depressed, they tend to assume what we call depressive moods, and someone who is depressed, they tend to be sad, hopeless, and tearful. Especially with kids, they tend to cry when they are depressed, actually for a long time. And also, someone who is depressed will tend to assume that feeling of being unworthy. They tend to say they feel unworthy, and they are also socially withdrawn from other people. They don't interact a lot with friends and people. They tend to stay alone. Actually, they can even live in houses. People with depression tend to have what we call suicidal thoughts. Suicidal thoughts are common. You can tell someone who is suicidal by the way they are behaving. Some people tend to talk about committing suicide, and they tend to ask how it feels to commit suicide or to die. And majorly, you will find them they have acquired items that they are planning maybe to kill themselves, like red rats, chemicals, agrochemicals, and others tend to buy new ropes, and also acquire sharp knives. And people with depression also tend to have they tend to lose weight, and this is common because it is noticeable. You can notice someone who has lost weight drastically. I'm saying it's a group of symptoms, so you're not just going to pick one symptom and then say it's a group of at least five of those symptoms which I'm talking about. So once you notice that someone has those symptoms, and also this change in what we call daily normal activities, they tend to lose interest in activities that they used to enjoy. Like, let's say, for example, you are someone who's a fan of going to gym, or you love going to social meetings or meeting other friends. You tend to withdraw from that and also lose interest in activities which you usually used to enjoy before, and that is what we call anhedonia. And they also tend to change. Depression tends to change what we call the sleeping habits, like the sleeping patterns, and most of the times they may oversleep or even lack sleep. They may have hypersomnia or insomnia. So Those are just the basic symptoms of depression. With that in mind, at least you have a clear picture of what bipolar is. Bipolar is a combination of manic episodes and depressive episodes. Well, watch out the next video that I'm going to upload, RUV Psychological. Okay, if you enjoyed this video, please just go subscribe. You can also share and you can also comment on my YouTube channel. Thank you so much. And the next video we are going to talk about managing bipolar disorder. Thank you for watching.